An effective response to HIV must be community-driven. During 2009, UNDP relaunched in Lesotho the Community Capacity Enhancement Program known as CCE. Through a facilitated conversation, CCE empowers communities to explore and implement homegrown solutions regarding HIV and other social challenges.
A conversation is an event where community members come and talk about issues that concern them, and more specifically, in Lesotho, with an HIV prevalence of 23.6%, HIV always comes up as a key issue.
A community conversation is a facilitated change process which requires the use of CCE facilitators to promote an interactive dialogue.
The CCE facilitators were selected by the community councils.
UNDP facilitated the training of CCE facilitators by providing workshops and translating the CCE training material to Sesotho. The program created a pool of local CCE experts to train CCE facilitators.
Each trainer has his own topic, or the topic he's supposed to deliver to the participants.
CCE facilitators conducted community conversations in 3 communities where the methodology was piloted. At the last stage of the conversations, every community formulated its own plan about development.
The conversation being successful, it should be of 6 visits to one village or one community.
Community conversations supported the government of Lesotho in strengthening HIV prevention and improving access to services. There is clear evidence of the results and impact of this methodology in empowering communities to make decisions and take action.
Community members were able to hold decision makers accountable to say, if we have a non-functional health center in our community, what are the issues? How can we as a community contribute to making that functional for ourselves?
CCE reinforced communities' knowledge of HIV issues. In particular, it changed men's attitudes towards HIV prevention, testing, treatment, care, and support.
Male involvement in HIV and AIDS is very limited, but following the introduction of community capacity enhancement, there's evidence of male coming forth to demand HIV and AIDS services.
Bringing an awareness of people what HIV and AIDS is, bringing an awareness of how or what they can do themselves to change behaviors and challenge behaviors of people they see in their communities, I think is a very key point and where the community conversation has really helped to bring much more to the forefront.
The conversations increased the number of services provided to communities and community initiatives for HIV home-based care, change in harmful traditional practices, support to orphans and vulnerable children, and peer education in HIV and AIDS. CCE focuses on strengthening the competencies of communities and organizations that implement this program. One of the key program implementing partners, Lesotho Network of People Living with HIV and AIDS, LENEPWA, noted that the community conversations address stigma and discrimination associated with HIV and AIDS.
In these forums, people living with HIV are in a position to disclose. And that being the case, more acceptance is enhanced.
The community-focused nature of the CCE program enables communities to respond to HIV and related challenges. The Lesotho experience has revealed that strengthening the community's voice enhances accountability of policymakers, motivating them to be more responsive to the needs of communities and stimulate demand for better public services from service providers.
Meralo ena e hlahang setjhabeng e kenella ka hare ho meralo ya rona ya le lekgotla mme ebe e fetela boemong ba lekgotla la strike bala e fetele ntlo kgolo masego.
Setjhaba se tlameha ho utlwisisa hore se etse ntho e thweng ke tshalo morao ya ditumellano tsa dipuisano tsa bona.
The Lesotho experience in implementing the CCE program suggests that the answer to a community's development challenges lies within that particular community.